Scotland should become a zero transmission country for HIV in the next decade. That was the commitment from the Scottish Government in 2020, and there'll be a debate in Holyrood later on how to achieve this ambition to mark World AIDS Day. The charity Waverley Care would like to see testing increased and also better public awareness through an anti-stigma campaign. Well, let's speak to Anna Cowan from the charity and Gary, who lives with HIV and works with Waverley Care as a peer mentor. Morning to both of you.
Morning.
And
good morning.
Gary, thanks for coming on. What's your experience like living in Scotland at the moment with HIV?
At the moment, stigma is a huge fight that we've got. It's a battle that we have to think about every single day. People are still experiencing stigma. Generally, HIV, due to antiretrovirals of today, are much, much better. And anyone who is on antiretrovirals now, who takes the medication every day, is unable to transmit the virus. And we call that U equals U, untransmittable.
Gary,
equals undetectable.
Yeah, we've been talking about the fact that PrEP and a preventative drug and antiretrovirals mean that people live pretty normal day-to-day lives. We've been talking about this for years. Well, why do you think there's still such a stigma attached?
That's a very hard question to answer, Laura. I think partly comes from the early days of the virus, when it was stigmatised to the gay men, and it was mainly, not solely, but mainly gay men who were killed in the early days, and it was likely reported as the gay disease. Mm-hmm. And I don't think that's actually gone away.
What do people say to you, or do you just not tell people?
I'm quite open about my status, hence being on here this morning with you. Generally, I get a lot of acceptance and support. I have received stigma. I had an incident at a front gate just over a year and a half ago, where somebody verbally attacked myself and my partner because of the fact that I'm HIV positive. And there's a commonly known thing that once it's out there, you can't take it back. But friends tell friends who tell friends, and that may well come back on you.
Yeah, and Anna, I suppose just listening to what Gary says there, if there is still that stigma against people with HIV, does that put people off even just getting tested for it in the first place, never mind getting treatment for it or seeking help?
Absolutely. I mean, it's really awful to hear the stories, and at Waverley Care we receive a lot of stories that are similar to Gary's, where people feel deeply ashamed because they live with HIV, and that shame is also reflected in uptake of tests. People may hear the word HIV and immediately feel frightened and scared, and they can't quite pinpoint it. And I think that's the problem. It's the unknowingness of what HIV is for a lot of the general public that puts them off getting tested, which is why down in London they've introduced opt-out testing, which is provided at emergency departments and hospitals. And it's been so successful in finding people with undiagnosed HIV. They found over 800 new diagnoses in the first 100 days. So, if you're just provided a test and you're offered one and you take it, the chances are that will be the way that we'll find those people living with undiagnosed HIV, and we'll hopefully get to zero transmissions by 2030.
Are we in a situation where there's lots of people who don't think that they will probably get HIV because it's not the gay illness anymore, as Gary was saying people thought of?
Absolutely, yeah. I mean, in 2015 in Glasgow, there was an outbreak among people who inject drugs. And as we know in Scotland, we face huge issues with drug deaths. And, people see HIV as an issue that doesn't affect them. But, we all have sexual health, and we all have a responsibility to look after that. And so it's really important that people do go out and get tested, because it just makes sure that you're protecting your own health, those around you, but also knowing that HIV is not the scary thing that it once was. As Gary was saying, if you're on the right treatment, you can live a long, healthy life and you can't pass the virus on. So it's just making sure people are aware of the reality of HIV.
We're going to hear from the government later today in Parliament. They promised back in 2020 to try and make Scotland a zero HIV transmission country. What would you recommend that the government needs to do now to make that happen? Because obviously I'm assuming things will have slipped because of the pandemic.
Yeah, they absolutely have, which is totally understandable, but we'd really like to see some strong commitments from the Scottish Government today, one of which is expanding testing and introducing opt-out testing in emergency departments. We'd also really like to see, as you mentioned earlier, widening access to PrEP, which is a preventative medication that's really, really effective in preventing HIV when it's taken correctly. Scotland was the first country in the UK to make PrEP available via the NHS, but we'd really like to see that expanded because we know that not everybody who needs PrEP is currently on it. And we'd really like to see stigma, as Gary was saying, which affects people so kind of fatally and detrimentally. We really want to see that stamped out, and we think a great way of doing so would be a public awareness campaign, which would just, as I said, kind of show people the reality of HIV and that it isn't this scary thing that it once seemed as though it was, and just educating the public generally.
And Gary, you're a mentor now, helping people who are newly diagnosed get their head around it. Is it a different experience that they will have now compared to yours, 20 years ago?
Yes, it most definitely is. There weren't peer mentors around when I diagnosed, and oh my gosh, I would have absolutely loved to have been able to access that kind of service and relate confidentially to someone who lived and has lived experience like myself with the disease. Most definitely. We have direct experience. It changes lives. It saves lives. Peer mentoring is just absolutely amazing. There aren't many of us, but what we do is vitally important and so very much appreciated that it's supported by Waverley Care. And we are very proud to work with all the people who are staff at Waverley Care.
Well, listen, let me thank you very much indeed to say we appreciate you coming on to talk to us this morning. Gary there, who lives with HIV and mentors others, and who works with Waverley Care as a peer mentor, and Anna Cowan there from the charity as well.